my goodness.
Yeah, good
No
morning.
worries,
Good
no
morning.
worries. All right. Good morning, good afternoon, good evening, depending where you are, where you're watching this live. This is the voice and the face of Dr. Olabintan, CEO, founder of Living Spring Family Medical Center here in Mansfield, Texas, where we believe in helping patients live long and well because we believe that the quality of life you have is just as important as the quantity of life. I'm excited to be here again, doing another live with the awesome Dr. Dana Gibbs. Yay, I'm going to give her a chance to introduce herself. And today's topic, we're talking, Doc, I have allergies, or what options do I have as far as allergies? Okay. Now,
Oh,
that being said, I'm going to hand over to you, Dr. Gibbs. People are
okay.
wondering, who are you and what do you do?
All right. So I am Dr. Gibbs. I am an ENT doctor. I live in Arlington, Texas, and practice in Arlington,
Mhm.
where allergies are really, really bad pretty much all year round. I've been in practice for about 23 years now.
Wow.
Um, and I had to kind of start learning about allergy in self-defense about 2 years into my ENT career. I realized, you know what, my patients, I do the surgeries and they're not getting well
Hmm.
because I'm not taking care of their allergies. And um, I spent a lot of time sending patients to the general allergist, and I don't know if they just weren't sick enough or what, but I would get them back with a prescription for an allergy pill. And I was like, no, 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 no. This patient is sick. They need allergy treatment, like allergy shots. Um, but anyway, so I decided I needed to learn it on my own. Well, not on my own. I went to the ENT meetings that are
Mhm.
for allergy treatment, and I learned how to do it. And I got a lot of help from manufacturers reps and from another allergy society that I joined, um, and experience over the years. And I've just learned how to do allergy shots. And then we added allergy drops and food allergy treatments into the mix. And I've been doing that for a long time.
Awesome, awesome. Good morning, Tiffany. Thank you for joining us. We have a guest. So next question for you. People are wondering, when you say allergies, what do you mean? Now I know that's a very broad question,
Yes.
but for the sake of this talk, when it comes to needs for allergy shots and allergy treatment and immunotherapy, um,
Mhm.
try to be as concise as possible. But what are allergies? For those who are wondering, do I have them? How do I know if I have them?
All right. So allergies basically are an inflammation reaction that happens in your body because of your immune system. So your immune system is mainly supposed to protect you against viruses and bacteria. And then there's another part of your immune system that's supposed to protect you against parasites. And parasites are worms and other kind of yucky stuff that we really don't have in the developed world so much anymore. And so that part of your immune system kind of doesn't have anything to do. And so in people who are predisposed genetically, their body starts attacking things like pollen grains and dog dander, which is a skin particle, and mold spores and things like that. It can also attack food molecules once you take them in. So it attacks in the parts of your body that are either exposed to the air or exposed to whatever those particles are. So that's going to be your the tissue inside your eyes. It's going to be the tissue inside your nose. It's going to be your lungs when you breathe things in. It's going to be your skin if it gets on your skin and goes through broken skin. And then it's going to be your stomach and your GI tract if it's something you swallow. Um, so inflammation is mucus, swelling,
Hmm.
itching, pain, um, and it's very, very unpleasant. In Texas, we have exposure to those pollens and those animal hair things and those mold spores, we have that all year round. And so people from varying degrees suffer a lot. And it's the estimates are that about 20% of people in the US suffer in some degree from allergy.
Hmm. Very, very interesting. And thank you for that insight as to why it is, as far as the parasites, the immune system not being able to, attack, certain types of microbes, and that's why they divert their attention to being sensitive to pollen. I didn't know
Yeah,
that.
our environment is too clean, and
Wow, and that's the issue.
we
Wow.
if you get a bacteria, we give you an antibiotic and we take care of it right away, and so your immune system doesn't have very much fighting to do. So it's always looking for things to fight, and then it decides that pollen is what it needs to fight.
Wow. Awesome. Thank you. Thank you. I'm taking notes. All right. Next question. Who would you recommend allergy testing for?
Okay.
Yes.
Yeah.
Who would you?
So allergy testing. Okay. So there are so many ways to treat allergy. So when people first start noticing, hey, you know what? I feel sick a lot. I have a runny nose half the time. I feel like I have a cold every other week. I can't breathe through my nose half the time or more. Every now and then I will encounter a patient, and the people who are like this don't come and see me because they're like 2 weeks in the year in the spring and they feel bad and they take a pill and they feel better and they don't ever come to see a doctor because they take care of it themselves. But what happens in Texas for a lot of people is that it gets to be more and more and more frequent. And then soon one medicine isn't enough and you try two medicines and maybe three, and then you're having to take it every day. And then it kind of gets to where it doesn't work anymore. And when somebody is having symptoms 6 months or more out of the year,
Mhm.
or when they're having reactions like asthma, where it's really serious and they're having them frequently, then that's when I start thinking about allergy testing for that patient. And the main reason I do allergy, well, there's two reasons to do allergy testing. First is to find out what you're reacting to, of course.
Okay.
But then the second one is to know how to mix a formula for allergy shots. And a lot of people are pretty unfamiliar with what allergy shots actually are because a lot of people have had that 2 weeks in the spring and they're really miserable just for that 2 weeks. And they go to their doctor and they get a shot of cortisone or Kenalog or one of those kind of steroid shots. And they get that once a year and they call that an allergy shot. But what that really is a steroid shot. Um, and those are fine, but they have side effects. And so if you have the kind of allergies where you're getting them every few weeks, you can't keep taking cortisone shots. They have enough negative side effects that's not really a good plan for your body. So then we pick what we do is once we have an allergy test, we make a serum from the actual things that you're allergic to, from the pollen, from the mold spores, from the dog dander. And we train your immune system with those by giving you that shot once a week or that sublingual drop every day for a good long period of time. And gradually over time, it trains your immune system not to react to those things anymore, which can give people very extended lifetime relief or even a cure from their allergies. But it's a slow process and it requires effort on the part of the patient, and it is not something you do if you just have 1 or 2 weeks of allergy a year.
Okay. That is key. And I wanted to highlight that you had talked about the different ways that allergies present in someone's body. And so it tends to
Mhm.
affect the eyes, the mucous membranes, your lungs, your nose, your
Sure.
skin, your ears
Yeah.
as well. And so when you start to see that there's a tendency to have allergy-like symptoms most times of the year, or a good amount of time throughout the year, then that's something that you should consider. We also mentioned, the difference between steroid shots and allergy shots. Steroid
Mhm.
shots are steroids given to suppress your immune system. They
Yeah.
have dangerous side effects, and
Yeah.
so are not something to be used routinely. And so if you're having these symptoms, you should talk to your primary care doctor, ask for a referral to an allergist, an ENT that specializes also in allergy, an allergist like you are,
Mhm.
and talk about what options you have. Now, you did mention also that the allergy, the immunotherapy, which is what we're talking about, the
Mhm.
allergy shot, um, it takes time. So it's not something
Yeah.
like and I think that's where patients get to a little discouraged, because you get the first shot, you expect just like a steroid shot that you're feeling better
Instantly.
right away,
Yeah.
but not necessarily. It takes time as your body is adjusting to the new information that helps it not react so violently.
Absolutely.
So
Yeah.
violently to allergens. Okay. Now, let's talk about the different types of allergy testing, because some people are, they'll go to their primary care doctor's office, or they'll come to your office asking for specific types. What different allergy testing are available to determine what kind of immune allergy shots a patient needs? What are the options?
Okay. So my preferred option
Okay.
is a skin test, and the kind of skin test that we use is called a prick puncture, and it is done with a device that looks um, a little bit like a spider. It has a series of prongs that come out, and they have little points on the end, and we dip that in the allergy serum, and we put it on your skin, and then it sits there for 20 minutes and makes little bumps on the things that you're allergic to. Um, and
Doc, you make it sound real scary. First, you use a spider.
well, okay, it's not a spider exactly,
I
but
know.
it's a piece of plastic with little points that stick down.
Not as painful. All right. It's
Not a
not.
shot. It
Yeah.
doesn't break the skin. A lot of people might have had something called the TB time test in their life, with little plastic prongs that go on your
Mhm.
skin, and they make little holes that are not all the way through the skin, and that's what a prick test is.
Okay.
Um, and then the follow-on test is a very tiny needle that we just barely put into the skin,
Okay.
and that's what we in my practice call a confirming test. And that's done in case the prick test is negative and we want to find out for sure, you're not allergic to this thing. Then we use that confirming test. So that's one way. But then there are some people who are on certain medications, or they just don't like the idea of the pricking and the needles. And they can go to a lab and have blood drawn for what's
Okay.
called a RAST test, or an immune test. It's a test that measures a certain chemical in your blood system, called IgE. And that IgE is specific for cat, or Bermuda grass, or for whatever pollen we're talking about. And we can measure that. But my experience has been that those blood tests don't find as many allergies as the
Mhm.
skin tests do. And so if I'm going to make allergy shots for somebody that I really feel like is going to be the right thing for them, I prefer the skin test in that situation.
Okay. And I like that there's a backup, like confirmatory test. That's unique.
Mhm.
I don't yeah, that's pretty unique. And I think it'd be of more value to patients, because sometimes it gets a little frustrating. I know I'm allergic to something. I sneeze when I'm around a lot of things, and they do the tests and it's always normal.
Yeah,
There's something. So having that backup, I think, makes the test even more valid. So very,
yeah.
very important information.
Mhm.
Um, Now, our next question is, now, how does the immunotherapy work? And you alluded to it earlier. Hi, Clara. Thank you for joining us.
Mhm.
Um, and I, there's a concern that it may suppress the immune system, so it's not able to fight off infection. Um, so what would you say, like how does immunotherapy work? So we can reassure our viewers that no, it works this way. It doesn't attack your system. It doesn't, like how
Right,
does it work, please start?
right, exactly. Okay, so the way it works is once the pollen. So okay, so here first let's talk about how it works when the pollen gets into your nose.
Okay.
Because it's important to understand that before you understand the difference between that and when it's injected under your skin.
Okay.
So when a piece of pollen or dust from a dust mite or dog dander gets into your nose and contacts the cells of the mucous membranes, there are chemicals in those cells called IgE. And IgE, if you can imagine, they look like a Y. They like if you imagine my hand is the base of the molecule, and then this thing sticking up is the top of the Y.
Hmm.
And the allergen will stick to these forks on the top of the Y. And each one of these molecules is designed where it only fights one kind of pollen. It only attaches to one kind of pollen. And those little molecules are sitting on the surface of the cell like this. And when the pollen grain comes in, and imagine, a cell is little and the pollen grain is big compared to the size of the cell.
Yeah.
So, but the cell has dozens or hundreds of these little molecules sticking out from it all over, and they're all different because they're all for all different allergens. But what happens is the pollen grain is big, so one sticks, and then once a second stick, it does what's called cross-linking. Um, and what cross-linking does is it causes that cell to break open little sacs inside the cell that release these chemicals that are toxic, and they cause itching, and they cause blood vessels to leak, and they cause pain, and they cause swelling.
Wow.
Um,
Mm.
and they recruit more cells which bust open and create more chemicals. So this chain reaction that happens once your body is exposed and primed. And what we want to do with the allergy shots is we want to break that chain reaction.
Okay.
um, and so what happens is when you put the allergen in your system, either through the mucous membranes of your mouth underneath your tongue or through your skin, then they are presented to your immune system in a different way that doesn't cause that cross-linking reaction that releases all the bad stuff. Now, it does cause a little bit of swelling, like, a shot, an allergy shot will swell a little bit and have a little bump. That tells me your immune system is doing something. Now, I don't make it so strong that the bump gets, really big and really painful. That's not the goal. Um, but once those allergens are presented to your immune system in a different way, then it causes your body to do what's called a class switch, which means it makes IgG instead of IgE. And IgE, which is present in the mucous membranes of your nose and in your lungs and in your inner ears and all the places, um, is what causes the symptoms from allergy. So when we can switch the class over to making IgG, which circulates in your bloodstream and doesn't directly contact with allergies, then that's preferable, and the reactions will basically go away. And that's
Awesome.
a very long-winded way of
Thank you
explaining.
for the breakdown.
It's not too over your head.
So essentially, you are helping the body not to overreact to something that could trigger an allergic response by switching from IgE to IgG, something like that.
Exactly.
So that's very good. So your body is not like it's not attacking you so much in an effort to help you fight off a trigger. Now I have questions from the audience, and Clara asked that does this will the skin test determine the level of allergy? Some people have severe, moderate, mild. Like would it give you clues as to how severe the allergy is?
That's a super good question. So you would think that that's the case. You would think that the bigger knot you get on your skin, the stronger your allergy reactions. And it's actually not completely true. So I have tested a lot of people in my office, and sometimes we would experiment like on the office staff and things. And I had one office staff, and we tested her, and she reacted to so many things on the skin test. And she never had stuffy nose a day in her life. So, so the answer to that, the short answer is no, it doesn't actually correlate very much. And that's one of the reasons why I like that confirming test that I was talking about. Because if you just use the prick test and you get a whole lot of negative tests, or maybe you get one positive test, and you say to the person, oh, you're not very allergic. Well, that may not be the case, because their experience is their nose is stuffy every day. Or they get sinus infections all the time, or they get ear infections all the time, or they itch all the time. So when we find a lower grade allergen on that confirming test, a lot of times that person is the one who is going to get really good benefit from being on allergy shots. So basically the answer to Clara's question is no, it doesn't correlate that well. It's really a yes or no answer.
Well done, Doc. And the thing also, too, that's very important, I wanted to highlight, it's really important to tell your symptoms to your doctor, because not everyone needs to get allergy testing. Sometimes the symptoms, would be a good hint as to who should. And it is important to have those discussions with your primary care doctor until you can get a customized plan for you, depending on what your family history is, depending on what your symptoms are, as well. Thank you, Doc. Next question she also asked, does the allergy shot reduce severity of food allergies? I know we talked about environmental allergies, but there's a segue now into food allergy. What would you say to that, Doc?
I would say the short answer is no. When I do a food allergy test, it's really a whole other can of worms, actually. The main thing you're looking for with a food allergy test is to make suggestions as to which foods you should try eliminating from your diet to see if you feel better. And truthfully, food allergy testing, if it's for something like peanut or shrimp, where the reaction is immediate and severe and scary, and could potentially be life-threatening, then yes, those blood tests are useful if you don't know what the allergen is. But truthfully, if a patient has had a reaction like that, a severe hives or throat closing up or anything really severe to a food, then I rarely will be comfortable telling the patient that it's okay for them to go back and eat that again, unless that test comes back completely zero. And even in that case, I'm going to still be nervous about it.
Okay.
But there are other kinds of food sensitivities, and there's a lot of controversy about this, and other allergists would say that they're not food allergies exactly, but there are other ways that people react to foods besides an anaphylactic shock reaction or a severe immediate allergy reaction. You can get GI upset. You can get something called celiac, which is a severe gastrointestinal tract reaction, and actually it spreads into your whole body, and it's a neurologic disease as well, where you react to gluten, which is a component of many grains, including wheat. And those you can test with a blood test, but there's really not a shot for any of that kind of stuff that does anything significant that I have seen.
Okay.
Unfortunately.
Thank you. I know. And there's so many foods out there to even consider. Like, how do you even begin testing?
Yeah.
And then,
Like we could talk for hours about just what to do with food. And it's, the short answer is, what I start people with is I start them with a diary where you write down literally everything you eat for about 10 days. And you look for, if you suspect you have a food allergy, but you're not sure what it is, write down everything. And then look for the foods that you eat all the time. And any food that's in your diet 2, 3, 4 times a week has the potential to be causing a reaction in your body. And it can be anything from a headache to a stuffy nose to postnasal drainage to GI distress to eczema. Eczema is an allergy, basically. So all of those things are food triggered and not particularly this IgE reaction that I was talking about before. So once you figure out what those very, very frequently eaten foods are, then you have a good idea of what things you need to temporarily take out of your diet and then put back into your diet to see how you're reacting to it. So what you do, for example, if you think corn is a problem for you, corn is in a lot of stuff. Corn is corn syrup, which is in soda pop. It's in cookies. It's in salad dressings. It's in so many things. And then there's also, of course, corn chips and, cornmeal, cornbread, blah, blah. So if you want to take corn out of your diet, you want to take everything that contains even a trace of corn out for a period of about 5 days. And then when you have done that, then you want to sit down on day 6 or so, and you want to eat a couple of ears of corn and see what happens. And if you eat enough of a serving that you feel full, like that's your whole meal. This is it's a test. It's not meant to be delicious. It's just you eat it, and it's a test. And then if you do fine for the first hour, then you eat another little partial serving. And if you still do fine by the next morning, and there's no weird symptoms, there's no headache, there's no stomach cramps, there's no, wow, I felt so tired I had to go lay down in my bed and sleep. And actually, that's what happens to me when I eat eggs.
Interesting.
If you have none of those reactions, then it's probably okay for you to eat corn. And what, somebody who's really got a lot of food allergies, I say don't eat it every day. Eat it every 4th day, every 5th day, and then you won't later end up with reactions to it. So that's, in a very simple way, that's how you do a test on a food that you're worried about. Now, that said, here's a caveat. If you put a food in your mouth, like a strawberry, and it makes the roof of your mouth itch, or it makes your tongue feel funny, or it makes your throat feel funny, and you start going, that is an immediate reaction. That's a severe food allergy. You should not eat that thing anymore. And there's more to it a little bit, but anything that causes an immediate reaction in your body, you pretty much need to stay away from it. And no allergy test that you take is going to tell me it's okay for you to eat that.
Right. Right. So there's some clues that your body will give you pretty quickly.
Exactly.
If that happens, it's not, oh, let me try it again. It's a, you know what? Maybe I should just stay off of this because my body's finding this is a bit much.
Exactly.
All right. Awesome. This has been very, very helpful. And you've given viewers also simple ways to check for their own food allergies safely. Now, of course, this is medical suggestions or medical suggestions. It's important for you to have a conversation with your doctor to come up with an individualized plan for you. But I love the simplicity of what you just taught. That's very, very important. I will share that with my patients as well. Now, another question coming from the live is, do you tend to see that patients outgrow these allergies?
So allergies will kind of wax and wane through people's lives, and yes, there are stages in life. So older children who have a good variety of food in their diet will not have as much food allergy reactions as very small children who eat, mac and cheese and peanut butter sandwiches as their only food. They have, because their immune systems are immature and because they eat very few food ingredients, have a much higher reaction rate or reaction severity. And then once your diet variety increases, that tends to fade out. But what I find for a lot of people is that it can come back in sneaky ways and bother you later. So I see so many people who say, doctor, I have postnasal drip. I have I have this all the time.
Yeah.
And very, very frequently, if I have people go through that process that I was talking about taking the food out and putting it back, they will find that there's one or two foods that are causing that postnasal drip, that clogged nose, that sensation of mucus, and that if they can stay away from that food, that they will really get a lot of benefit out of doing that.
Awesome. Thank you. Thank you. Very, very informative. Now I have one more question for you. Is there a way to minimize the risk of you having an allergic reaction? Is it possible to reduce your risk? Like, are there things to do to reduce your risk of getting allergies? It's something I know.
There are. That's an interesting question too. So there's once again a lot of controversy about this because they have done studies and said that, for example, if a child is born into a house where there are already animals and they are exposed to that animal between 0 and 6 months of age, then they're much less likely to be allergic to that animal later in their life. Whereas if you wait and get a cat when the child is 2 and they have the genetic tendency from their parents to get allergies, then the likelihood of them starting to have more symptoms after that later exposure is higher. The other kind of things you can do. So say you already have allergies. There are things you can do to reduce your exposure to allergens that are super helpful. And this is not just live in a bubble, because that's what people think I'm trying to tell them, that they have to just live in a bubble and never go outside and get rid of their cat and all these things. And I'm like, no. There's lots of things you can do. And a lot of it is knowing what the source of the allergens are. So if you are having outdoor symptoms, like every time you go out and it's windy, then you're sneezing and you're itching and you're swelling in your eyes and things like that, you maybe even having an asthma attack. There are things that you can do. And, COVID has taught us some of this. And I've had a lot of patients coming back going, my allergies are so much better now that I go for a walk with a mask on when it's windy outside. And I'm like, yeah, of course, you're not breathing as much allergen. But there are other things you can do. So, for example, I ask people if they know they're allergic and they have a family member who's allergic, when you go outside and you spend time outside, that when you come back in, you leave your jacket at the door, you leave your shoes at the door, you take a shower, because pollen gets in your hair, it gets on your eyelashes, it's on your clothes, it's up your nose. So anything you can do to reduce that allergen amount that's on you before you lay down in your bed and put your hair on your pillow, which is full of allergens, then the better off you're going to be. Also, washing your sheets in hot water is a really good way to reduce dust mite allergens and animal dander allergens in your indoor environment. Removing carpet. This is luckily, and I'm so happy about this trend of now everybody's going for the wood floors or the vinyl floors instead of carpet, because carpet is a huge trap for dust and mold and pollen, and it just leaves it in your environment all the time. So hard floors and washable curtains and keeping clutter out of the place where you sleep, like books and stuffed animals and things like that, Fluffy drapes and curtains. I'm so glad those are out of style now because they're just a horrible thing for people with allergies. And then another thing you can do is just make sure that you're using the good quality filters on your air conditioning system, the high HEPA filter vent filters. You can actually buy a HEPA filter from a store, Amazon or Home Depot or even Walmart sells a good brand of HEPA filters. And HEPA stands for high efficiency particle. I don't know what the last word is, but it removes the pollen particles from the air as you sleep. So you can do that instead of a ceiling fan. For somebody who wakes up stuffy every morning, if you'll use a HEPA filter instead of a ceiling fan, that person will feel so much better.
Okay.
So there's a lot of things you can do to reduce your exposure to allergens.
So you can still live life to the
Yeah.
fullest. Just make few adjustments so you enjoy better quality of life. I love it, Doc.
Absolutely. Absolutely.
I took a lot of notes. Thank you so much for coming. Now, people are wondering, this doc is awesome. She's a wealth of information. I would like to see her. I would like to connect with her. I would like to have her come speak at an event about allergies. I would like her to help my office come up with better solutions as far as allergy testing. Where can people find you, Doc?
Sure, absolutely. So I have a website. It's called allергyaccessmd.com that has my contact information on there. You can also email me at that same address, Dr. Gibbs, DRGIBBS, at allergyaccessmd.com. So those are my business and personal links, but my practice is at Central Park ENT in Arlington. That's www.centralparkent.net. And we're in Arlington and Dallas and at Fort Worth, and would love to see you.
Awesome. Thank you, Dr. Gibbs. Really, really awesome having you here. And I look forward to connecting with you soon.
You bet. Well, I have enjoyed this very much, and thank you very much for having me. And I am so pleased with what you're doing with your lives, and it's just wonderful, just wonderful.
Thank you. Thank you very much. And I'm getting feedback too that this was very helpful. Thank you. Very informative. Thank you. So awesome having you.
So glad to hear it.
All right. That being said, we're done. It was nice seeing you. Please share for those who know people who could find this useful. Please share. It is good to share. And that being said, if you or anyone you know is looking for an awesome, a thorough, a passionate family physician here in the Mansfield, Texas area, I am she. Thank you.
I agree.
Thank you. Bye.